Okay, we would like to introduce our new maternal child health manager, Rebecca Anderson, who will share some DMAS agency updates with us. Thank you, Rebecca.
Good morning, everyone. I'm very happy to be here. This is my first quarterly community doula meeting. I just started my position a few months ago, working with Natasha and the other women in the maternal and child health unit at DMAS. So just want to, I'm so glad to be here. You'll get to know me in the coming months. This is a very high priority for the agency, not only our unit, to ensure that we get doulas serving every corner of the Commonwealth. We want to recruit doulas and we want to retain you once recruited. And we know we have a lot of work ahead of us. Natasha asked that I particularly talk about some things that may end up impacting you and your work with our members down the line that are big pieces of news for the agency. And one of those is that we have just launched something called our Cardinal Care. And this is a set of new contractual requirements affecting our MCOs. And as you know, most of our members, the vast majority, are under one of our 6 MCO plans for their care. And when it comes to maternal care, historically, each plan has a lot of latitude to be doing their own thing. Under Cardinal Care, this new contract that we are implementing now, what it's going to mean for you and for our members is that the expectations are going to be more clear for our MCOs about what is required for our pregnant women and our postpartum women, particularly women that are assessed to be at some level of risk or have some comorbidities, including behavioral health concerns. There's going to be more information to come about this, but I wanted to plant that seed that the agency is doing a number of things to really beef up our support to our pregnant women, and that is one of them. And what that new contract does is it really gives us more leverage, more transparency. Our plans, things will be more clear for our plans so that they know what is expected of them, and they will benefit from that. And most importantly, our members are going to benefit from that. In terms of doulas, Natasha and I, some of our priorities there are working on claims, the claims process. Again, oversight of our MCOs to understand, are those claims being paid appropriately and timely? What can we do to improve that where it is needed? As you all know, doulas and even doulas in Medicaid, you may have lost me. Can you hear me?
I can
We
hear
can
you.
hear you.
Okay, good. My screen went blank there. Claims. That is another priority that we have to make sure that we're keeping on top of that and implementing improvements where we can. I was saying that doulas are new. They're new to Medicaid across the nation. And of course, it's new here in Virginia. So that's something that we'll be working on together, something I have some experience in my prior roles of working on with providers and making sure, particularly new kinds of providers. So network adequacy, which is another way of saying making sure we have those doulas in every corner of the Commonwealth, is something Natasha and I share as our priority as well. And then finally, that retention element. So making sure that our practicing doulas that are already involved can stay involved and be supported. So I just wanted to share a few of those things that we're working on. There is so much, and I could talk at length. And I imagine that one of these meetings, I'll come back and be telling you more detail about these initiatives. Just wanted you to know about my enthusiasm, that I'm glad to be here. I'm super duper excited, and you guys are absolutely critical. And the future is wide open for us to do some really cool things together. So thank you for having me.
Thank you so much, Rebecca. And now we will just share just a couple of brief community doula program updates. Just want to share that to date, we have 128 doulas that have received state certification, 98 of which are also Medicaid approved and able to provide services to Medicaid members. We want to say that since please mute your phones, everyone, and your computers. Since the implementation of the Medicaid doula benefit, over 300 Medicaid members have received the support of a Medicaid doula provider. And just a couple other quick updates. In August, we had a Southwest provider, DMAS hosted a Southwest provider meeting, which allowed us connection to doulas in Southwest Virginia. And so we were able to talk about really the need for families in that region of Virginia and really be introduced to some new doula organizations. Also, we have a new online maternal health newsletter that is actually the Baby Steps newsletter that is now in online format. So we're excited about that. And there'll be some doula information and doula updates in that newsletter as well. And then finally, we have um, the member Medicaid doula video has been completed and is available on our website. So I've included the links here as well as the other two provider videos. One is really focused on doula providers and the other for licensed provider community. So, and you will all get this in the slide deck at the end of this meeting. So I just wanted to make you aware of those. Also, for new and existing doulas, I wanted to make you aware of a resource by ACOG, which is really called Your Pregnancy and Childbirth. If you're not familiar with this book, and Consuelo's holding it up, and I also have a version here as well, which we will give away at the end of this call. So if you are a new doula, please put your name and contact information in the chat. We have about 3 or 4 of these to give away. And we want to be able to be a resource for you all to build your library and your resources. But I just wanted to include this resource here for you all. And so I have our contact information here. So I will end here so we can start with our speakers for today. And so first I would like to introduce oh, I'm sorry. I apologize. So our next agenda item is Virginia Doula Task Force updates from Kenda Sutton L. And Kenda, is Kenda on the call? And I know she had a meeting and she was going to hop in. Oh, here she is. And Kenda, we have just introduced you. If you will share some Virginia Task Force, perfect timing. That is perfect timing. Virginia Doula Task Force updates with us. Thank you, Kenda.
Hi, everybody. I hope y'all are all doing well. They have been doing extra work, y'all. Sorry I'm late. But actually, I was just on time, so y'all didn't even miss me. But so for the Virginia Doula Task Force, the updates are we have a meeting coming up on Monday. It is virtual, so if you want to join, you can feel free to join. However, if you are not on the task force, you can only talk during the public comment period. But also, we have some updates. If you are interested in joining the task force, we do have some vacancies that are available. So please feel free to shoot me an email and we can get you an appointment letter, or you can shoot Consuelo an email. Or even if you have Stephanie's, I'm not sure, but my email is right there. So if you want to email it to me, make sure that you have your email address. If you are a doula or if you are someone who received doula services, and then also your full address. I'm not saying that you will get selected, but we do vote on who's going to be appointed. And I think that is all the task force updates that I actually currently have. Of course, with Birth in Color, And please make sure that you're looking at different trainings. If you are interested in being a doula, but you're not a doula yet, will have those coming up. We also do have some informational webinars that's going to be coming out and starting January of 24. Just trying to make sure that doulas are getting the education that they need to go ahead and become Medicaid certified, and then also to dispel some of the myths about that it's not equitable, it's not great, because we need the numbers, and the only way that we can actually create change is if people are actually being a part of it and we're hearing what obstacles you are actually going through. So I'll turn back to you, Natasha, if no one has any questions for me.
Thank you so much, Kenda. We really appreciate your participation and sharing the Doula Task Force updates. Thank you so much. Up next, we will have Consuelo Staten, who will share doula training and state certification updates with us.
And good morning, everyone. This is Consuelo Staten with VDH. Just wanted to give you an update. It's so nice to see everybody here, and I know this is the coming up the end of the year, but we've done some great things over the year, and we'll have to applaud everyone for their efforts in this effort for doula certification and Medicaid doula support. Just wanted to give you an update. As Natasha mentioned, we have 128 state certified doulas. That's current, and we're really excited about that, and the numbers will grow. We have 2 new doula training organizations that have signed on to our approved list, and their names are, let me just get them here, a new doula and Mandwella Doula Network. And if you know of people who are interested in becoming doulas and they want to use these approved list doula organizations to go through the process of application, they can do that. And also, we have at least 3 pending doula training organizations that are in the application process for the Virginia Certification Board. So that part is still moving along and growing. Just wanted to also give you some information regarding doula training. VDH is working with Early Impact Virginia, which is a home visiting organization. They have statewide home visiting programs that we work within. And we're planning to put together some training that will be part of the doula supplemental training. So for instance, doula, the Early Impact Virginia training is home visiting based, but a lot of the training can be transferable to doula training. For instance, Home Visiting 101 is very similar to what I think doulas do in the family settings. And we are putting together what they will call a doula track that doulas can go into their training and get credit and information regarding that. We're also putting together a Doula 101 training for the home visitors so they can be aware of what we're doing in the doula world, and to show that they really have some transferable skills and that we're working together. As we were talking in one meeting, a family can have as many support people as possible, and a doula can be an additional person for that. Another training opportunity is through our VDH Chronic Disease Unit. We received a big grant that deals with heart, chronic disease and heart control, stroke and heart programs. And we are working together to um, launch a Healthy Heart Ambassador program that we are encouraging doulas to consider, to become trained to be ambassadors that will go out into the community and work with families to share their information about blood pressure. And so there are blood pressure cuffs, and there's some training that hopefully we can pull together so doulas, if they're interested, can be part of that process. And another thing I wanted to add was that through our VDH Office of Family and Health Services, we have Title V funding, that's MCH funding, and we are, through Title V, have plans to fund certification training in areas where the doulas communities seem to be less strong. So we are pulling together information on that, and Natasha and I are leading one of the work groups that will work with the local health districts and pulling together information about doula awareness in their communities. Another thing that we're pulling together through Title V is gathering data and TA to doula collectives that are seeking additional funding through grants. And we are really excited about that. The doula, we're also putting together a district doula work group. Out of the 35 local health districts in Virginia, 11 of those are very interested in working with doulas and making sure that there's awareness of doulas in their community and training opportunities. So we are working to pull all that together. And I think that is it for me. If you have any questions at all, please let me know. And my information is there, and you can put information in the chat, and I'll be more than happy to work with you to get to that answer. So thank you so much.
Thank you so much, Consuelo. We really appreciate all of the training and state certification updates. And now we have Holly Day Bernard with our VCU Medical Center that will be sharing a little bit of information on promoting doula inclusivity. Thank you,
Hi,
Holly.
everyone. My name is Holly DuBernard. I'm the nurse manager of labor and delivery at VCU Medical Center downtown here in Richmond. We have done a lot of changes over the last year to really promote doula inclusivity at our facility, and we would love to share those with you guys. I am certain that some folks on the call have already come to VCU Health as a doula with our patients and your patients and have experienced the additional amenities that we provide to doulas. We recognize that doulas really promote that quality birth experience. You know, the evidence shows that doulas promote patient satisfaction and birthing patient and baby outcomes and breastfeeding outcomes. So we're really excited to help promote doula inclusivity in our care team here at VCU Health. So first, we were tasked with a way for doulas to sign in, check in without the cumbersome process of paper tracking, or we previously had a doula list. Thankfully, we've moved into 2023. We have a very handy QR code form that a doula can check in right at the lobby when their client or patient comes into labor. They would simply scan the QR code with their phone, and you are welcome to scan the QR code here to see the questions that we ask doulas. Questions include name, email, if you're associated with a doula organization, and just attesting to abiding by our previously established VCU Health policies, and that you have some form of doula training. We don't require you to provide that certification or transcript of doula training. When you check in, just attest that yes or no, you have that training. When you fill out this form, you'll get a confirmation screen from our lovely registration clerks that sit behind the desk, as pictured here, and you will get a very specific doula badge. So this is something we created last year to help identify doulas in our environment, because we understand that you provide that additional experience to our patients. You're not just a visitor. You know, you are here helping to support our patients to have the birth that they want and to have good outcomes. So we want to recognize that you are part of our team by giving you this special badge. So as you can see, it does say visitor on the badge, and that's per VCU Health policies. But again, we wanted to recognize that you provide so much more to our patients, and we want to make sure that you are recognized as such in the labor room. All right, next slide. Thanks, Natasha. Another great thing that we have at VCU Health is the very first doula respite room. And this was created to help promote, again, more doula inclusivity in the labor and delivery setting. It is a small room that is designed to not look like the inside of a hospital. We wanted to make it a comfortable space for doulas to come and rest and recharge while they're providing that continuous labor support to our patients. There are snacks and drinks available in here, and it's a locked room where you can go and take a quick nap and just be ready to go back and provide that amazing care that you provide to patients. You'll also receive a card that has a code to the respite room. Again, the room is locked, but it's accessible with a punch code lock. And is that the end of my slides there, Natasha?
I think so. And so, yeah, that was the end of Holly's presentation. Holly, just a couple of quick, and I do see where I think we have a question, but what are some of the ways that doulas are integrated into the birthing parents care team?
Definitely. So we understand that doulas can help provide that emotional support to our patients, not just saying, "You got this, mom," but really helping our patients. And they're not just our patients, that they're shared, they're your clients as well, making sure they understand what's going on with their care. So they can act as a liaison with the patient and the medical team that's here in the hospital. We really strive to work together, and we try to promote doula inclusivity in the operating room whenever it's safe and appropriate for patients. And we have created an algorithm to do that. We also understand that doulas can help patients make decisions. Again, if they don't completely understand something, they can explain it in a different way. You guys already have that wonderful established relationship with the patient, and we may be meeting them for the first time here. Again, I'm sure you're all very well aware, doulas also provide that wonderful physical support. So it's not just breastfeeding support after delivery, it's positioning during labor, counter pressure on the back or hips during labor, massage, non-medicated pain relief techniques, breathing techniques. I could go on for a very long time, but it comes full circle. They provide that emotional, spiritual, and physical support.
Thank you so much, Holly. We really appreciate it. I know that there's a question out there. If you could please put your question in the chat. We want to just be mindful of time, and we want to be able to share your questions with our guest speakers today and get some answers for you if you do not mind. And up next, we have Doreen Fleming, who will share some information about doula support and breastfeeding. Thank you
Hey,
so
Mr.
much,
Davis, I'm
Doreen.
sorry. I'm in a meeting too at the same time. Hey, can you hear me? Hello?
Yes, we can hear you, Doreen. If we can just remind all of our participants to please put your phones and computers on mute, that would be great. Thank you so much. Welcome, Doreen.
Thank you. And thank you so much for the invitation. I feel like I'm home. You all are my people, and I'm always happy to share. Some of the information I'll be going over will be very familiar to many of you, and hopefully it will just reaffirm what you're already doing with your families. And for others, perhaps some of this information will be new. So please advance the slide. So why is breastfeeding important? Hey, Valerie, I just saw you putting in the chat, human milk feeding is the perfect food for babies. And the feeding method is also the perfect method from the body at the breast. It provides nutrients, vitamins, and minerals tailored specifically for your baby. It's easy to digest, and it protects infants against diseases and illnesses. You can think of it as baby's first vaccine. Reasons why feeding at the breast is important include that the baby will develop strong oral facial muscles that help to improve their breathing, their swallowing, and their speech development. Additionally, it protects infants from sudden infant death syndrome, or SIDS. In fact, it can be cut in half by exclusive human milk feeding. Breastfeeding is important for lactating parents as well. Nursing baby at the breast frequently, beginning right after delivery, releases hormones that will help to stop bleeding quickly after delivery, help speed up recovery from childbirth, help the uterus return to its pre-pregnancy size and shape, and help the lactating parent to feel calmer, more relaxed, which may help reduce the risk of postpartum depression. Other reasons breastfeeding is important: it reduces the risk for certain types of breast and ovarian cancers and diabetes in the birthing parent. It also helps with pregnancy weight loss because of the number of calories that are burned during lactation, particularly exclusive lactation. It will help to reduce that pregnancy gain. Some of the the weight that is gained during pregnancy is specifically to support lactation. So if you don't breastfeed, where are those calories going to go? You're still going to keep them. So bonding through skin-to-skin contact is very important for the parent and for the baby. The baby will feel safer and more secure being close to mom while nursing. That skin-to-skin contact helps the milk to flow and will help the parent to feel more peaceful and calmer. And research shows that breastfeeding is associated with decreased childhood maltreatment, which is a very fascinating area to look into. I encourage you all to do your research on that. Bottom line up front, exclusive breastfeeding is the single most effective intervention to improve the survival of children. Improving infant and young child feeding practices is critical to improved nutrition, health, and development for children. Next slide, please. So, next slide, please. Maybe there's a little delay, and you're muted, Natasha. So I, don't need the slide to talk. So how can you advise your families that you're working with to prepare for baby's arrival? Planning makes it easier for them to achieve their goals. And some things that can help will include attending a prenatal breastfeeding class, seeking out other moms, for a mom-to-mom meetup or group. They may be available through WIC as well as other community organizations do mom-to-mom meetup groups. And ask them to attend before the baby arrives so they're prepared. Reading, if they have time. Breastfeeding books are available through libraries. They don't have to be purchased. You can check out paper copies, ebooks, and even audiobooks through any Virginia library. Thank you. Preparing the physical space also helps you meet your goals. I've included images here of water bottles and phone chargers because it's helpful to have these within reach when you're starting to breastfeed. And what are some other things that you recommend to your families that you're supporting to support their breastfeeding journey? I'd love to learn from you. So put that in the chat. Next slide, please. So here's a worksheet that we have through the WIC program that you can share with your families to help them figure out their breastfeeding goals. Once the first goal is reached, they can set a new one, and the link to be able to download those that worksheet is there on the slide. Next slide, please.
It's up, Jareen. It says how to get off to a good start.
Yes, thank you. So, and like I said, I feel like I'm preaching to the choir, but I'm sure that you all are already advising your clients to make a birth plan. Let the staff know that they intend to breastfeed. Doing skin-to-skin contact as soon as possible after delivery, requesting to see the hospital lactation consultant, requesting no formula or pacifiers to be offered, and to plan to room in. Those are a few of the 10 steps to breastfeeding friendly practices, and the link there will take you to the rest of the list. It's so helpful, and you play such a critical role to educate your families so that they know what their options are for their birthing experiences and how the birth facility approaches breastfeeding before delivery. So just informing everyone, letting the doctors and nurses know in advance that they are planning to breastfeed, to talk to their doctor during their pregnancy about where they will deliver, and then to take a tour of that facility. Many of these practices I'm sure that you are already doing. Next slide, please. So I neglected to say that I'm the state breastfeeding coordinator. Yes, there is a job like that in all 50 states and territories. And I'm housed with the WIC program. So the WIC program can help support with anytime and anywhere. We provide many benefits for breastfeeding parents. most of which I'm sharing today comes from this WIC website that I invite you to visit for resources, and also for the Breastfeeding 101 class that you may take yourself and or share with your families. WIC supports breastfeeding by providing access to breastfeeding peer counselors, which is a paraprofessional with breastfeeding experience that has been trained by our program. WIC participants who are breastfeeding receive a bigger food package, and they will receive that for longer, up to a year, for the entire duration of their breastfeeding journey. Additional breastfeeding staff support is there as well if there are any issues outside of common routine breastfeeding challenges. And also we do have a lending, we have pumps for families to have and keep, and also pumps that are higher grade, more efficiency, what is frequently referred to as hospital grade pump, to be loaned. So please remember that WIC is here to support breastfeeding. In the beginning of when this program was founded, the main way that infants were being fed were through commercial milk formulas. And over time, we've learned from the research that's out there how important breastfeeding is. So we have really been making a point to center breastfeeding within the WIC program. So early referrals to WIC during prenatally is also very helpful. That means that we have that many more opportunities to touch those families and to educate them and let them know what resources are available. Speaking of resources, next slide. Here's a list of resources that I encourage you to share with your family. The National Women's Health and Breastfeeding Helpline and several other community-based support groups. Next slide, please. I would be remiss if I did not share resources for you. So I strongly encourage all birth attendants and doulas to seek lactation education. Here's a comprehensive series that is offered for free to Virginia providers through a partnership that the Virginia Department of Health, Maternal and Child Services has with the University of Virginia. The Breastfeeding Consortium can prepare you to know what is routine in breastfeeding, what's a routine challenge, and also to help you to know when to refer for expert assistance. And so that's that's something that's very important for you. You're the person that this family knows and trusts the most. You're there on the front line. So I really, really want to deputize all of you to please go seek additional lactation training for yourself, to add that into your kit. And also, it's just really important to be able to know when to refer. So that's the Breastfeeding Consortium. That is, the link is also live there. I'd also another resource that you can share with your families is that we are very fortunate now to have 4 lactation or breastfeeding medicine clinics in Virginia, kind of in every region of the state. And on the next slide there, they are all listed. And again, links to those, their websites, their phone numbers. That's something that you can refer your families, your patients to. So I talked really fast along the basics. I really finally want to mention that the right to breastfeed in public is protected by Virginia law. If any of your families or if you yourself have any concerns about these rights, I invite you to please contact the Virginia Department of Health, Office of Family Health Services at our email address, VA Breastfeeds. We do have breastfeeding law cards that you can go onto our website and download to share those cards with your family. And it's not on this slide, but I'm sure that you all are all aware that Virginia was a pioneer in providing workplace lactation supports for working families. And now we actually have a federal law as well to protect the right to breastfeed. We know at least within Virginia WIC, one of the most common reasons that families report why they stopped breastfeeding is because they had to return to work or to school. And so both in the school environment, people who work in schools and students in schools have the right to have a space and time to express milk during their work period and during the school period. Additionally, people in workspaces now have a federal protection, the PUMP Act is now requiring all employers with 5 or more employees to provide an adequate space and adequate time for working families to be able to express milk during the work period. So thank you so much again for having me today. To talk this quickly about breastfeeding is a challenge for me because I'd be happy to do a much longer education session as needed or requested. But if you have any questions, please put them into the chat and I'll just respond while the next speaker is talking. Thank you.
Thank you so much, Jareen. That was fantastic. I'm really just so excited to have so much knowledge and resources for our doulas in the doula community today. And
My
I'm
pleasure.
also, thank you. And I'm also excited to introduce Christina Hood, our next speaker, who is Associate Professor of Psychology and Director of the Progress Lab at Virginia Commonwealth University, Christina Hood. And I
Hi.
will stop sharing for you to share your slides, or would you like me to?
It's completely up to you. If it's easier for you to continue to share, that's fine. Otherwise, I have them on my other screen.
Okay, that would be great.
Oh. Oops. Can you all see my
Yes.
slides? Okay, sorry. For some reason, it did not start at the beginning. Thank you all very much for your time today. I really appreciate to be given the space. Today, I'm going to quickly just kind of chat about postpartum support. I know that a lot of the information that is included here, you all are often aware of, but I can say for many birthing people that I talk to, doula support and the larger support system is so crucial during the postpartum time, and being able to help support families is just so important because it's such a period of huge transition. And so a lot of people find themselves stuck with lots of questions or concerns and not necessarily knowing where to turn. So just a quick note, I am going to be talking about postpartum hardship today. And I know that that can bring up emotions for some people, thinking about not only their experiences, but the experiences of others. So please take care of yourself. If you need to step back, please do. I just want everybody to be comfortable throughout all the different things that I'll be talking about. So congratulations. A number of people, this is getting to bringing home a baby is a long journey. It's not a quick journey for everyone, and that journey isn't always linear. And so, I want to stop and celebrate if that is a point for you to be able to bring home a baby, that it is a joyous moment and it's a moment that is very exciting. Our society, though, has this perception that parenthood is innate. It's easy, like we just magically wake up knowing exactly what to do, and that it's going to always be blissful, and that we're always going to be having sunshines and rainbows. um, and in reality, that's not the case. Parenthood is amazing, and it is also hard, and sometimes we don't acknowledge that that is difficulty within that journey. Um, and particularly for the primary parent, for birthing people, our society automatically puts primary responsibility of parenting on this individual. And we have had full lives before becoming parents. And so there's a lot of transition to that. There's also a lot of individuals who feel very comfortable giving us their opinions about how we parent, what we're doing, and whether we're doing it right. whether it's someone you love or know well, or just somebody else in the grocery store. Once we become parents, society just has this new view that we are now people that individuals can just kind of give us advice. And advice is helpful sometimes, but judgment and criticism isn't always helpful when you're navigating a new space. So, why the postpartum period to me is a very important period is because more than 50% of maternal deaths occur in this period. And so, it's important to make sure that we're protecting the birthing person and our babies throughout this period, because this full year is a time where there's just a lot going on for the family, and sometimes people aren't able to fully care for themselves or make themselves a priority with all the different things that they're navigating. When you think about some of the main causes of death during the postpartum period, we've got hemorrhaging, hypertensive disorders of pregnancy, infections, and cardiovascular conditions that can complicate, that postpartum period. There's also a lack of information about what is normal during the postpartum period. So a lot of mothers talk about not knowing, if they're bleeding. Are they bleeding too much? Are they not bleeding? Like, what's going on with their bodies? Because, during that recovery, a number of people just aren't sure what to expect, what's norm and what's not. And then there's the added complication of going back to work, going back to school, and not having full policies to support new families within the US. And so 1 in 4 birthing people go back to work within 10 days after childbirth. And so if you think about, all that your body has been through and how long it actually takes to recover from childbirth, you know, the literature says it fully takes 18 months for your body to fully heal. Can you imagine, like, having to go back to work within 10 days, and what those implications are for your postpartum journey? And so a lot of what I focus on is what we refer to as the fourth trimester, which is that 12 weeks after birth, where a lot of birthing people talk about having a decreased interaction with their care team. Because like when you're going through pregnancy, especially towards the end, there's an increase in interaction with your care team. And then, after birth, um, there's a period where for some birthing people, you won't see anybody for 6 weeks or more. And your body is going through this massive recovery experience without sometimes having someone there to kind of help you and guide you through. Um, and then, we have all the different transitions. You're trying to know who you are as a person now, in addition of being a parent. You have your transitions at home. For those of who are in school, you have those transitions. Transitions with your partners, if you have a partner, your families, financial transition, especially when you add in childcare, and childcare right now. And then all of the different other things that are happening with your friends, and all of your different relationships. There's just a lot going on. Over 85% of birthing people report some symptoms of anxiety and depression during that time, even though many people may not reach what they refer to as clinical levels. Most women report experiencing hardship. And so, thinking about all the different components of postpartum care. I briefly touched on the physical recovery. Our previous speaker talked about, chest health and chest feeding and how, the implications of that through your postpartum journey. We've got emotional well-being. You're also taking care of another human. So, infant care and feeding, sleep, and fatigue. And then thinking about your own sexuality, birth spacing if you are going to try for another, uh, as well as your own health and well being, your previous health on top of your current health, as well as just maintaining your identity in yourself, and caring for yourself. And so, when you think about all the different things that birthing people uh, have to consider during this time with lack of sleep, with all of these transitions, there's just a number of postpartum concerns that can come up. And a lot of people talk about not knowing where to go or who to ask, or having people available to ask at the time when they need help. And so, what I'm going to try to in 5 to 7 minutes is kind of go through some of the things that birthing people have talked to me about, um, as their challenges that they faced during this period. And so, in this study, I did Facebook groups with Black birthing people within the first 12 weeks after after giving birth. And we had 20 people in a Zoom room, kind of similar to this Teams call. And we had 6 virtual sessions where we basically was come as you are. Just log on. We're just here because we just want to provide a space to talk about what's happening, and if you have any questions or concerns. 3 of those sessions we had research prompts where we asked very specific questions, and the other 3 were just there for support. And so it was whatever the birthing people brought up at the time. So we had 54 people who completed all 6 virtual calls. Um, Mean age of 27, 64% were first time parents. And so the first prompt that we wanted to discuss was postpartum health experiences. And so a number of birthing people said that they really felt that they had a hard time with interactions after birth and really had a hard time trying to figure out who to go to for questions. So, like one mom said, I felt abandoned. Every time I would message my doctor, I was bounced around and couldn't get answers. My OB would send me to my PCP, who would send me back to my OB. So I gave up. Another talked about not asking questions because they didn't know who to ask. So they went to Google or they asked their sister. And so during this postpartum period, a lot of people who had questions about chest health or about, other experiences that they were having with their body were having a hard time trying to figure out who is the person that I ask, and then how do I get answers and how do I get support. Another prompt we asked about was postpartum appointments. And so, for those who did not go to their 6 week postpartum appointment, what were some of the reasons? They talked about childcare as being one of the main reasons, and that it was hard because some places, especially during COVID, um, would not allow their child to come with them. And so they weren't able to go to the appointment because they didn't have childcare. And then a large group of individuals talked about that by the time that they got the appointment, they didn't feel like they needed it anymore. And so when they had a lot of questions in those first couple of weeks, they didn't really have anybody to go to. But by the time that their appointment came around, they were like, it either resolved itself or I figured it out. And so that was part of their challenge. Every single session, people talked about when they felt that their support system should check in and when it would be helpful for individuals to just kind of see what kind of support they needed throughout this period. Because a lot of people talked about that when they felt like they needed it the most, there weren't people around. Um, and they said that transitions is really the big one. So, like when they're returning to work, whenever that is for them, that was a huge transition, and that's when they saw so much of the hardship happening because there's just so many more variables happening. Changes in childcare. For those who have used daycares, there is a lot of illness that happens, and that when you first start daycare, and like that just creates a lot of challenge. The financial strain, trusting individuals with your baby when you have to go back to work. Others were changes in feeding and sleep. Um, and so people really felt like those were the times when they really needed a lot of support and really felt that the support would be really helpful. I have another set of information about specifically things that women have said, but we only have 5 minutes left. So I'm going to stop here and I'm happy to come back to finish and talk more about postpartum support at a different time. So thank you um, for giving me this time, and I'm happy to answer any questions in the chat.
This was so fantastic. And I know we just have 5 minutes left, but in that next session, is there, or the section that you didn't share, are there, one or two things that you could tease out? And one of the things I want to just say during the meeting is I really, really, really am grateful to all of our speakers, all of our participants on this call. In 1 hour, I think we have scratched the surface and introduced a lot of different topics. All of our speakers were engaging and really fantastic. We've talked about inclusivity in the hospital setting. We've talked about breastfeeding and breast health and support. We've talked about the postpartum period. And so in our last couple of minutes, I see our speakers are still with us. If we just have just a couple of questions, again, if we are not able to get to the questions, please drop them in the chat. Again, we have just scratched the surface. Any one of these topics we could delve into at great length, but we wanted to continue to provide resources for our doulas and our doula community, connections, information, as well as the printed resources with the ACOG information as well. And we will continue to do that in these calls. And so another thing that you can type in the chat is just anything that you would like more resources and information on, and how we can help, or how our resources can help you. So I will pause there. If there are any questions for our speakers in our last couple of minutes here. And feel free during this period, if you have a question for the speaker, to unmute yourself to ask a question. Okay.
Well, I'll ask a question of Consuelo so that everybody can hear the question. I was excited to hear about this development plan for training with early impact. So have you thought about having a breastfeeding, or what the breastfeeding component of that training will be?
We know that that would definitely be included. They do have breast feeding training for Early Impact Virginia home visitors, but we can definitely loop everything in so it can be the doula track that will hit all of those coursework that will be beneficial for doulas to have.
Awesome. I'm happy to help in any way I can.
Of course.
Okay. Well, we are at the end of our time. Again, I just want to thank everyone for joining. I hope this is our last meeting for the year. We will rejoin in January, where we will be doing our kind of year in review and looking ahead and talking about what's ahead for the community doula program. So stay tuned for that. You all will get a copy of the slide deck, and with permission of our speakers, if it's okay with them, we will be able to share their decks with you as well. So you will get that as well. Again, if anyone is interested or knows of anyone who's interested in our doula information sessions, interested in becoming a doula, those are coming up. The dates are posted for December. There'll be some January dates out there. It's a really great place for you to ask one-on-one questions. Maybe you don't want to ask in a larger group or conference setting. So we kind of have office hours where you can have that kind of one-on-one session. So again, just wanted to thank you all for your time.
And thank you.
Everyone have a great day.
And Natasha, thank you for pulling us all together. This has been a really good workshop. Thank you so much.
Thank you all. Have a great day, you all.